Do your socks leave deep dents in the skin by evening? Do your ankles feel like heavy stones after a day of sitting or standing? That kind of nightly swelling is more than an annoyance. It's often a sign that blood and fluid are pooling in the lower legs instead of returning efficiently to your heart. That pooling, called venous stasis, makes your legs feel weak, slows healing, and raises the chance of dangerous clots. The good news? You can start a focused bedtime ritual tonight that nutritionists and vascular-minded clinicians use to decongest the lower legs, support vein health, and give you stronger, lighter-feeling legs over weeks and months. I'll walk you through a 7-step bedside protocol: what to do, why it works, exact timing, and the safety checks you must run first. If you want more clear, practical senior health protocols in plain language, hit subscribe now. First, a brief reality check, so you understand why a targeted ritual matters. Not all swelling is the same. Some puffiness is cosmetic. Fluid sits in the tissue and easily rebounds when you press it. But when a finger leaves a lasting dent, so-called pitting edema, that usually signals deeper problems. The valves in the leg veins aren't pushing blood upward efficiently, capillaries are leaking fluid into tissues, and electrolyte shifts are holding water in the cells. Common tips, just elevate your feet or cut salt, help only a little. Real change comes from addressing both the mechanics, how to move fluid out, and the physiology, how to alter cell and vessel behavior while your body is in repair mode at night. That's why this protocol focuses on internal priming, mechanical pumping, thermal stimulation, topical venotonics, gentle compression, timing of fluids, and nighttime repair supplements. You'll do these steps each night as a ritual. Taken together, they push stagnant fluid out of the ankles and calves, tone small veins and capillaries, and deliver supportive compounds while the body's repair systems are most active. Important safety note before we begin: check with your healthcare provider, especially if you have kidney disease, heart failure, uncontrolled high blood pressure, or if you take diuretics or blood thinners. Some supplements and electrolyte shifts can be risky for those conditions. Now, let's get into the 7 steps. Step 1. Internal electrolyte priming, the pre-sleep magnesium plus potassium cellular flush. About 60 minutes before you go to bed, take a gentle dose of magnesium and a modest source of potassium. Magnesium helps relax smooth muscle and vessel walls, supports lymphatic function, and improves sleep quality. Potassium helps cells release sodium so water can follow and be excreted. A common, well-tolerated approach is 300 to 400 milligrams of elemental magnesium in a bioavailable form such as magnesium citrate or magnesium glycinate, taken with a small glass of water.
For potassium, do not guess doses on your own. Instead, either include a potassium-rich small snack earlier in the evening, half a banana or a few slices of avocado, or use a clinician-approved low-dose potassium supplement. Avoid sudden large potassium loads without medical clearance. If your clinician approves the combined approach, take the magnesium about an hour before bed and keep your potassium modest and verified. Why this timing? The hour before sleep gives the magnesium time to enter cells and relax vessel tone while you're preparing to lie down. That relaxation, combined with the controlled moves you'll do later, encourages intracellular sodium to shift out and water to move back into circulation where the kidneys can excrete it. Again, do this only after you've checked with your clinician if you have kidney issues, heart failure, are on diuretics, or take medications that affect electrolytes. Step 2. Contrast foot and calf baths, the thermal hunting response reset. After the internal primer, move to a contrast bath cycle that uses alternating warm and cold immersion to force a vascular pumping reflex. Fill 2 shallow basins or tubs, one with warm water you can comfortably tolerate, not scalding, around a warm shower temperature, and one with cold water plus ice or cold tap water. Sit comfortably with your feet and lower calves submerged. Protocol: warm soak for approximately 3 minutes, then switch immediately to cold for 60 seconds. Repeat that warm then cold cycle 3 times. Finish with a final cold plunge for about 60 seconds. During the warm phase, you'll feel tingling warmth and perhaps mild swelling. During the cold phase, you'll feel constriction and a sharp temporary sensation. That alternating sequence forces vasodilation and vasoconstriction in quick succession, producing a pumping effect in smaller veins and capillaries and encouraging fluid to move centrally. Who should skip or modify this? If you have peripheral neuropathy, very poor circulation, recent wounds, or uncontrolled hypertension, avoid abrupt cold shocks and check with your clinician first. Moderate the temperatures and shorten the cold period if you feel pain, numbness, or lightheadedness. Step 3. Active inversion pump. Legs up the wall with ankle point flex cycles. After the contrast baths, lie on your back with your legs up vertically against a wall, hips as close to the wall as feels comfortable, or lie on a couch with your legs supported on a cushion elevated above your heart. This position passively unloads the veins. Add a short active ankle exercise to recruit the calf muscle pump, the single most powerful mechanical driver of venous return. Protocol. While legs are elevated, alternate pointing your toes away from you, plantar flex, for about 5 seconds, and then flexing the ankles towards you, dorsiflex, for about 5 seconds. Continue this rhythm for a total of 5 minutes. That's roughly 30 cycles. Pace it gently.
The deliberate point and flex squeezes the calf muscles rhythmically, pushing pooled venous blood and interstitial fluid upward toward the heart and kidneys. Breathe steadily. You should feel a lightweight pumping sensation in the calves. If lying flat or elevating legs causes discomfort, prop knees slightly with a pillow. If you have a history of retinal detachment, severe glaucoma, or other conditions where head down or prolonged inversion is contraindicated, choose a milder elevation or consult your clinician. Step 4. Topical venotonics, gentle upward massage with cypress and rosemary. Once you come down from legs up the wall, use a mild topical venotonic massage to stimulate local circulation and provide a warming, toning effect to the skin and superficial veins. Essential oils used by clinicians for circulatory stimulation include cypress and rosemary. Both should be used diluted in a neutral carrier oil, like sweet almond, fractionated coconut, or jojoba. Mixing guidance. Use a low dilution appropriate for older skin, about a 0.5 to 1% dilution. Practically, that's roughly 3 to 6 drops of essential oil per ounce, about 30 milliliters of carrier oil. Apply a small amount and test on a patch of skin for sensitivity. Massage with gentle upward strokes, starting just above the ankle and moving toward the knee and then toward the groin, always toward the heart. Avoid deep kissing or pressure behind the knee, the popliteal fossa, and avoid broken skin. How it helps? The massage mechanically moves fluid and stimulates surface circulation. The essential oils provide a mild vasotonic sensation and sensory cueing that can enhance lymphatic response. Keep the pressure comfortable. This is about tone and movement, not deep tissue work. Step 5. Nighttime compression. Use only low-grade compression if appropriate. Compression can prevent pooling by providing a gentle, evenly distributed external pressure on the calf, but overnight compression must be conservative for safety and comfort. If you use compression at night, choose low-grade support in the 8 to 15 millimeters mercury range. These are essentially mild support socks, not medical-grade stockings. They should slide on easily, feel snug but not tight, and should not dig into the skin or leave deep bands. Remove any socks that cause numbness, color change, or pain. Do not sleep in high-grade or prescription compression, 20 to 30 millimeters mercury or higher, unless explicitly advised by a clinician who knows your full vascular and cardiac picture. Who should not wear compression at night? People with severe peripheral arterial disease, uncontrolled heart failure, or certain neuropathies should not apply compression without specialist advice. If you're on medication that affects circulation or sensation, double-check with your care team. Step 6. Timing your fluids, the 3-hour evening fast. Overnight, the body shifts into repair and fluid redistribution modes.
To reduce the amount of pooled fluid your body has to deal with while lying down, stop consuming large volumes of fluid approximately 3 hours before your regular bedtime. That gives your kidneys a window to process and excrete excess fluid while you're still upright, and gravity helps venous return. This is not a dehydration strategy. Small sips of water are fine, and if you're thirsty, take a little. The idea is to avoid big drinks right before you lie down. For older adults who take evening medications or who are at risk of nocturia-related falls, plan timing with your clinician to balance hydration, medication schedules, and sleep quality. Step 7. Nighttime systemic repair supplements, horse chestnut and pycnogenol, used judiciously. Certain natural venotonics have been studied for chronic venous insufficiency and capillary fragility. Two commonly referenced options are horse chestnut seed extract, often abbreviated HCSE, standardized to acene, and pycnogenol, a proprietary French maritime pine bark extract. These compounds may support venous tone, reduce capillary permeability, and assist repair processes when taken consistently. Typical clinical ranges you'll see in studies and practice: horse chestnut extract in doses from about 100 milligrams up to 300 milligrams daily, with formulations standardized to acene content. Pycnogenol, commonly used at 50 to 150 milligrams daily, with many programs using roughly 100 milligrams. If you choose to use either, take them in the evening so they're circulating during your sleep window of tissue repair. Crucially, product formulations vary. Standardization, ingredient purity, and the amount of active compound differ by brand. Safety and verification. Verify the exact product standardization and check with your provider. Horse chestnut must be from seed extract that has been processed to remove toxic components and standardized to contain acene. Do not use raw or unstandardized horse chestnut. Pycnogenol is a trademarked extract. If you use alternatives, verify equivalence. Do not begin these supplements with medical clearance if you're on blood thinning medications or have clotting disorders. Both agents can interact with anticoagulants. Also check with your clinician if you have liver or kidney disease. Add a clear on-screen or packaging check step in your routine. Confirm product labels and standardized content before starting. A few practical behaviors that undo progress, habits to stop and small changes to keep.
The simplest mechanical hazard is leg crossing. Crossing your legs creates a localized obstruction to venous return, compressing the vessels and immediately increasing pooling below the point of cross. Make a conscious habit of sitting with feet flat on the floor, or when resting, placing a small pillow between your knees if you sleep on your side. Avoid prolonged sitting without movement. Get up briefly every 30 to 45 minutes to walk or do a short calf contraction in place.
Other slow harms include certain evening foods and heavy salt-laden meals late at night, which can increase capillary leakage and sodium retention. You'll hear more about that in the follow-up video on 3 everyday foods that weaken vascular elasticity. Putting the ritual together, an example evening timeline you can follow. About 90 minutes before bed, finish your main evening meal and avoid large salty dishes late. 60 minutes before bed, take your pre-sleep magnesium, 300 to 400 milligrams elemental in a bioavailable form, and incorporate a modest potassium source only if your doctor has said it's safe. 30 minutes later, prepare your contrast basins. Do the warm for 3 minutes, cold for 60-second cycle 3 times, finishing cold. Immediately after baths, lie legs up the wall and do 5 minutes of point flex ankle cycles. Follow with a gentle upward massage using your diluted cypress and rosemary oil, applied from ankle toward knee. Put on low-grade compression socks if advised and comfortable. Then go to bed after your 3-hour fluid fast window. If you take horse chestnut extract or pycnogenol and your clinician has approved it, take those just before bed. What realistic results you can expect and when? This protocol is not an overnight miracle, but many older adults notice reduced evening heaviness and less visible pitting within a couple of weeks of consistent nightly practice. Over months, improving vascular tone and lowering persistent edema can reduce discomfort and improve walking endurance. Strengthening comes from reduced swelling, better calf pump function, and the cumulative effect of better circulation. Keep expectations realistic. These steps support function and reduce symptoms. They do not replace medical evaluation or treatment when a clinician identifies a specific vascular disease that needs intervention. Safety checklist, the must-read before you try anything new. Do not change prescription medications or stop anticoagulants or diuretics without a clinician's order. If you have kidney disease, heart failure, uncontrolled hypertension, or take blood thinners, see your provider before starting electrolyte shifts, horse chestnut, pycnogenol, or any new supplement. If you have sensory loss in the feet, diabetes with neuropathy, severe peripheral arterial disease, or an active leg ulcer, modify thermal and compression steps only with clinical guidance. Verify supplement labels for standardized eskin content in horse chestnut products and for authentic pycnogenol if that's what you choose. If at any time you experience new calf pain, redness, unexplained shortness of breath, or sudden swelling that isn't improved by these measures, seek prompt medical evaluation. Those can be signs of deep vein thrombosis or other acute problems. A few troubleshooting tips.
If contrast baths cause too much discomfort, shorten the cold phase to 30 seconds and stay with gentler temperatures, or skip them and emphasize the ankle pump and massage instead. If compression feels painful or causes numbness, remove the socks and consult a fitter or clinician to reassess sizing or necessity. If magnesium gives you loose stools, try a different form. Magnesium glycinate tends to be gentler on the bowels, or reduce the dose and discuss alternatives with your provider. A short recap to lock it in your mind. Step 1. Pre-sleep magnesium plus a verified modest potassium source, 60 minutes before bed. Step 2. Contrast baths. 3 cycles of warm, about 3 minutes, cold, about 60 seconds, finishing cold. Step 3. Legs up the wall with 5 minutes of 5-second point, 5-second flex cycles. Step 4. Gentle upward massage with a 0.5 to 1% dilution of cypress and rosemary in a carrier oil. Step 5. Nighttime low-grade compression only, 8 to 15 millimeters mercury, if appropriate and comfortable. Step 6. Stop large fluid intake about 3 hours before bed. Step 7. Consider nighttime horse chestnut seed extract, standardized to ASIN, and pycnotenol under clinician guidance, verifying product standardization and interactions. Avoid leg crossing and prolonged sitting. Use a pillow between knees when side sleeping. This bedtime vascular reset is practical, doable, and built around your body's natural repair window. It blends mechanical pumps with mild thermal stress, topical stimulation, intelligent timing, and supportive supplements, so the legs aren't the last stagnant reservoirs at night. Done consistently, this routine can reduce swelling, ease the sensation of heavy legs, and give you safer, stronger movement over time. Before I close, one last safety reminder. Check with your healthcare provider, especially if you have kidney disease, take blood thinners, are on diuretics, have heart failure, or have uncontrolled high blood pressure. Make sure any supplements you consider are verified for standardization and quality. If your clinician needs to review dosing or interactions, let them know the specific product label and batch if possible. If you found this useful, watch the next video I'll link in the end screen. It covers 3 everyday foods that silently destroy vascular elasticity and what to eat instead. Try this 7-step bedside ritual for several weeks, be consistent, and check in with your clinician as needed. Your legs can feel lighter and stronger again, one careful night at a time.